The emergency department here at NUH is one of the busiest in the country, and we were under severe pressure with a number of patients attending through the department, and it creates an environment in which patients wait, care is delayed, access into the hospital is delayed. So I think we had some real issues in terms of the service we were delivering to patients. We recognised that from patient feedback and our own review of services. And we understood that if we could change ED, we could probably change most of the processes in the hospital.
Working within healthcare, it's of huge benefit to us to demonstrate our capability and the benefits we can bring to an organisation. Therefore, for KM&T to work with such a large, prestigious organisation as Nottingham, it really allows us to demonstrate in a very credible environment the benefits we can bring along programmes of work of this nature.
I think the key to the project was the partnership with an external consultancy, bringing in new ideas that we could cross-fertilise into the NHS and engage ordinary NHS staff through to show that we could make a difference and make a change.
I think the ED project was so different because we set out to look within the four walls of the emergency department, and we had support from a group of people called KM&T, who I think for the first time gave us some tools and techniques and approach that we'd never tried before, which was a lean approach. So it was very much based on lean thinking, and that's what made the real difference in the ED project.
I think the experience of dealing with external consultants can often be that they come in, take a lot of data and come back and tell you what you already knew. I've had a very strong sense with KM&T that they were really interested in looking at our problems, not providing us with an off-the-shelf solution. And they spent time actually trying to understand our business. And I think that was a very strong partnership.
Well, I think it's really important that we have a good relationship with the team, so we work very closely with them to make them feel at ease, because obviously it's something new to them and we're bringing different methodologies. So we want them to trust and believe what we're saying, for our expertise is right, but not trying to tell them what to do, because obviously they're the experts in their field.
I think first of all we were trying to understand how we could actually do the project. So we used KM&T's knowledge to help us understand the processes we were going to be using. That was a really important point. So they helped us understand what we needed to be doing to gather information, how to take it forward into various stages through the project. And that was crucial. We wouldn't have worked without them.
During the Productive Ward, we were exposed to a company called KM&T who supported us in developing the Productive Ward, and we liked their approach in terms of transferring the tools and techniques to the staff, and therefore we wanted to work with them in the emergency department to ensure that the emergency department also were transferred the tools and techniques and skills that KM&T brought to the Productive Ward to the emergency department. And that skill was the thing that we wanted then to be able to put into the wider programme across the hospital.
I think what the KM&T approach did for us was brought some tools and techniques we'd never used before, but a real rigour and an absolute sort of, if you like, a hand-holding approach in a very positive way. They were there with us every step of the way. They always made sure the staff understood what they were doing. They embedded the approach in the department, and they've left behind a real legacy in terms of understanding and a team of people down there who can keep the work going.
The difference with KM&T was they rolled up their sleeves, basically. They were shop floor workers. I think the day that they left here, people actually knew their names, which is very different. It wasn't just a select few of us who knew their names, it was the whole shop floor, 150 nurses, 100 medical staff. People knew their names because they rolled up their sleeves and worked with us. But
what is also really good for us is that when we look at things at all now to change things, we're using the methodology that KM&T taught us. We're not just going to say, this is a good idea, isn't it, let's do it. We're actually going to spend some time before we change anything, and that's crucial, I think. That's a crucial message that we learned.
The emergency department is a crucial area. The service you provide, the speed with which you provide it, and the quality of the service you deliver to patients. What I believe we've demonstrated here is an approach and a methodology that can bring real benefits to patients and the services they receive from trusts. The approach we've adopted here can be replicated and used elsewhere. The approach, the training and the knowledge transfer we've delivered brings real benefits to patients. It's been a real pleasure working on this project, and other organisations with similar issues, similar challenges can adopt the same approach and methodologies to bring similar benefits.
The emergency department did a lot of changes over a 9-month period and continue to make changes now. KM&T put people onto the ground floor working with the staff, and they managed to teach staff the tools around lean thinking and lean tools and techniques and skills, and supported people in their change programme, also around programme management and performance management, and keeping the project on track.
One of the key tools that KM&T taught us was about value stream mapping. So this isn't just simple process mapping, it's actually seeing it from the patient's perspective. And so really walking through the department physically with patients or with ourselves and videoing it and getting big groups of staff to look at actually what did that mean for patients, and then identifying what really did bring value to the patients. Redesigning a whole process and a whole department layout really based on that, so that we can deliver value for patients and deliver some real benefits.
I think they've given us the knowledge that we need. More importantly, for the long run, a lot of our staff now have been trained to use that knowledge and to continue to use that knowledge over the coming years, so that we can keep on improving. But yeah, they taught us a lot about how to look at things differently and come up with solutions.
They taught me, certainly, and they taught the whole department, lean methodology, which is, I know, a buzzword, but all it's about is reducing waste. And to a patient in our department, there was a load of waste, not value added to the patient at all. And I think they taught us how to recognise it, how to see it, how to visualise it, how to get all staff to visualise it, and then how to trial things differently to get rid of the waste. Now, to a patient, that's going to be the most important thing.
I think what they did was provide a very structured approach for the department. The department had a number of initiatives, but had never had an end-to-end structured approach of how they might go about leading change. Also the philosophy of engaging, involving and getting ownership for the change project, which also was part of the philosophy that KM&T brought as well into the department, and their ability to work with staff on the grassroots meant that staff were not threatened by having consultancy working with them, and were very open to learning the new tools and techniques.
It's really important that we have the clinical engagement, because ultimately they are making decisions around patients, and we want to be helping them to inform the right decisions so that the patient gets the best outcome. It's absolutely vital for us that clinicians are involved.
Engaging me, they were very effective, because I have been a bit cynical in the past about management teams coming in and telling us what to do, but they were very effective, because from the outset they said, we're not telling you what to do, we're going to show you some tools, teach you so you can do it yourself. And I think once they'd engaged me in that, it was no problem whatsoever.
My technical skills, wow, I'd never done anything like this before. I didn't know how to project lead, project manage. I've learnt all of that. I've learnt risk assessment, I've learnt lean, Six Sigma. I've learnt so many different skills. When I first started this job, I think I went home and nearly cried every night going, what am I doing? I didn't even know the words they were using, whereas now I understand it all. And it's great. It's really good tools. They've taught me so much about continuous improvement, changing things, challenging things, but also the technical side of things regarding managing, leading and that sort of stuff.
From the team's perspective, as regards the internal change team and also the frontline staff, I think it's given them the empowerment and the confidence to go through change and feel that they'll be supported if they come up with ideas for improvements, and that's key. From a patient's perspective, I think they'll have had much reduced waiting times, be seen very quickly, and ultimately get a much better service and much happier staff.
I think KM&T were very responsive. They were responsive to ideas, they were responsive to criticism, and they provided quite a flexible approach in terms of access time to consultants that fitted in around our demands. And they also pointed out some of the home truths about our organisation and areas where there were weaknesses and things that we needed to consider. So it was a real two-way interface, and probably for the first time in my experience in NHS management, one that worked really well for both parties.
The team in Nottingham were a fantastic team to work with. They were engaging, they were open to new ideas. They were a little sceptical to begin with, but that's healthy. It's healthy scepticism. They want to understand how we can work with them and benefit and bring our skills to complement what they do.
Yes, we had a good relationship with KM&T, and we worked closely together in terms of looking to ensure that there were patient staff and financial benefits coming out of the ED project.
So we worked very closely with lots of consultants, and it worked really well.
We're very lucky with the people, particularly Simon Bricknell, who's with us virtually every day for 9 months. Tremendous team, very helpful. We learnt a huge amount from them, and we couldn't have done it without them.
They know what I think of them. I think they're great. I think certainly as far as external consultants go in a hospital, the success of this program was the fact that we were paired with them and not a consultancy firm that didn't want to sit down and work with us, sort of thing. They wanted to sit down and stay till 10 o'clock at night and work out what was going on and what it was all about. They certainly didn't want to just speak at management level or at higher tier level. They wanted to speak to every single staff member. They wanted to engage, teach, learn, pass on that knowledge. So I guess we have to say thank you, because I don't think we would have got to where we were without them.
My relationship with NUH has been really, really close and really good, so I think we've had a very good professional working relationship, but we've also had fun along the way, and I think that's really important too.
If other organisations are looking for a lean approach to improvement, then KM&T certainly were able to deliver that training and that approach for NUH.